As you all are aware, we are in the middle of a second surge of COVID-19. This surge is worse than the one we saw last year, and consequently there are increasing number of patients, including younger people, who are being affected. One major problem with COVID, as we all know, is that many patients end up with very severe disease, needing to come to hospital and need oxygen. So I'll just give you a few tips on how to monitor your oxygen levels at home. First and foremost, I want all of you to be aware that only 10% of patients who are having COVID-19 disease actually need to get admitted to hospital, and less than 1% eventually need ICU. So that is a positive thing I would like to start with. So if you have been diagnosed to be having COVID-19, follow the advice of your doctor very meticulously. Be in touch with him through video counseling or any other video platform and follow his advice. It is important to monitor your saturation at least twice a day if you have mild disease or asymptomatic disease. So what do? You have a saturation probe or what we call as a pulse oximeter at home, and keep monitoring your saturation regularly. One sensitive test to do this is what is called as the 6-minute walk test, or in people who are unable to walk 6 minutes, we call it as a 3-minute walk test. So it's a very simple test which can be done at home, where you measure your saturation before you walk, and then walk or pace yourself or stroll up and down your room very casually without stressing yourself for about 6 minutes, and recheck your saturation immediately after walking. If there is a drop in saturation by more than 3%, then it could mean that you may be having early signs of progressing to a more severe form of the disease. So inform your doctor and make sure that you take adequate steps. An important technique to improve oxygenation is by lying down in what is called as a prone position. Now this is a test which I'm sure all of you have seen and used or have read a lot about it in the magazines and in the media. Basically what you do is you lie down on your bed, on your tummy, rest your head on a pillow and lie down flat on your tummy. And by doing this for a few minutes, you must find that the oxygen saturation or the reading of the pulse oximeter improves. Now this usually helps in more than 7 out of 10 patients or 8 out of 10 patients, and most of these patients do not need to need any other help beyond this simple technique. If you find that by lying in the prone position, the person or the patient or an individual is very uncomfortable, or if one of us is the patient and we are unable to do that, do not force yourself or force the individual to do that. As a compromise, you can ask the patient to lie down in the right lateral or the left lateral position, which is on the right side or to the left side, which is a compromise position and which will still work in many individuals. So the 6-minute walk test is useful in those people who have normal saturation, but you find that the saturation drops when they walk. This is a very early sensitive test to pick up early or progressing COVID-19 disease. Now in those individuals or in those patients in whom the saturation goes below 94% even at rest, ensure that immediate medical help is sought, and if it is less than 90, please make sure that the patient is rushed to the nearest emergency department in an ambulance and immediate medical attention is sought. I would like to emphasize in this context that keeping oxygen concentrators or using oxygen cylinders at home without any prescription by a medical practitioner could be highly dangerous and detrimental. The reason is oxygen is a drug and it has to be prescribed under medical supervision, and secondly, keeping an oxygen in a non-medical area has its own non-medical dangers such as fire hazards and such other consequences, and if the cylinder is not used properly, risk of explosion and such other complications can happen. So I would like to emphasize that please do not get into the practice of storing oxygen or oxygen concentrators at home when it is not necessary.
If you like this video, please like, share and subscribe to our channel.